Well, according to the World Health Organization, cancer is the leading cause of economic loss through premature death and disability worldwide because of the vast sums spent on treatment, but also due to lost economic and social activity. And for more on the devastating economic impact of cancer, we're joined by Dr. Gary Lyman, co-director of the Hutchinson Institute for Cancer Outcomes Research. Thanks for joining us tonight, sir.
It's a pleasure, Michelle.
Dr. Lyman, the World Cancer Research Fund says that 14 million people a year are diagnosed with cancer. That's a huge number, very devastating. What would you say is the total economic loss in the U.S. and globally because of cancer?
Yes, of course, totaling the economic impact of cancer or any disease is challenging. As you indicated, the estimates from the World Health Organization suggest that well over $1 trillion are being spent or have been spent on cancer in recent years globally. In the U.S., the estimates have been in the range of about $150 billion annually. However, keep in mind, these are probably underestimates. When you tabulate, again, the indirect costs, the out-of-pocket costs, the social costs, time lost from work, as you indicate, many estimates double those numbers. So we are probably talking, and particularly with projections moving forward, of probably in the range globally of $2 to $3 trillion annually in the coming years, in the coming decades. And in the U.S., probably approaching $500 billion to $1 trillion per year, if nothing else changes. And that's assuming no startling breakthrough and so forth. At the global level, of course, particularly in the developing world, as you've already alluded to, it's a particularly challenging issue because of the rapid growth in the population, the aging of those populations, because we are controlling things like infectious diseases and so forth. And at the same time, we seem to be shipping our cigarettes overseas, and tobacco use, obesity epidemic globally has been documented. And clearly all this raises the rates of cancer disproportionately in the developing world. And the deaths from cancer, of course, they are even greater in magnitude because they don't have the resources. They don't have the modern equipment, the modern drugs.
Dr. Lyman, some very devastating statistics here. The World Health Organization saying that the number of cancer cases will reach 24 million a year by 2035. And at the same time, the World Cancer Research Fund says that half of future cancer cases can actually be prevented. How can we prevent them? And what would the cost of these preventative initiatives be? Why are we not doing this?
Well, again, a lot of it is based on politics and economics. There are some major things and very cost-effective things that can be done to bring down the cancer rates, just like they have in the U.S. in terms of reduced mortality from cancer over the last 20 years. Those same effects could be represented globally if we were able to partner with developing countries to reduce tobacco use, to improve diet and increase exercise, things to bring down the obesity rates. There are vaccinations for some of the major cancers globally, cervical cancer for human papillomavirus, hepatitis B vaccination to bring down that 10% of cancers in the world that are due to liver cancer. There are many things that can be done on the prevention side. And then early detection, of course, has had a dramatic impact on certain types of cancers and bringing down the death rates from those cancers. And there are cost-effective or cost-limited ways of doing cancer screening, fairly low technologies on today's scale that developing countries can afford, things like ultrasound, things like mammogram. There are more expensive technologies, and of course they're gaining hold in the U.S. These countries can't afford that, but there are screening approaches that could be applied in the developing world to bring down those cancer rates. So I agree completely. There are the means at our disposal to reduce cancer mortality rates by half in the world if we put our heads together and bring the resources to bear.
Well, Dr. Lyman, a lot of information to take in there. In the interim, costs of treating cancer are overwhelming. What is the size of the conventional cancer medication market? What kind of a market is that?
Well, it varies greatly from country to country and region to region.
Obviously, what would the global number be?
Well, the global market, I mean, virtually all patients with diagnosed invasive cancers, cancers that can prove life-threatening, are now treated at some point in the course of their disease with medications. And of course, we've made great discoveries in medical science and molecular biology and genetics. And these have brought new therapies, new ways to control the disease, but at an enormous price tag for the research and development and then the marketing of these. So again, the cost of drugs and therapeutic interventions probably account for about a third of that total cost of cancer care that we talk about. On top of that are of course, the various diagnostic and procedures, PET scans, CT scans, and so forth. Those account for another big portion of those costs. These are very costly treatments and technologies.
Dr. Lyman, do you think that enough is being spent on research for cancer?
Well, absolutely not, and certainly not at a global level. But even in the U.S., we've seen on a real cost basis or a real dollar basis, investment into cancer research fall. Of course, sequestration had an impact. We've seen, of course, the investment in cancer not keep up with rising cost of doing cancer research. So there's not enough. And again, on a global level, it's even more disparaging. That we could probably also be doing a better job. Of course, there's a lot of costs going in or expenditures going into drug development, which is needed, but we have to put more money into prevention and screening opportunities that can really bring down these cancer mortality rates.
All right. Thank you for your insight, Dr. Gary Lyman, co-director of the Hutchinson Institute for Cancer Outcomes Research.